Good afternoon, everybody, and welcome to today's TNI webinar. The subject of today is the states of control and the dark side of pandemic politics. My name is Niamh Ní from Transnational Institute, which is a research institute and think tank, which acts as a unique nexus between activist scholars and movements, pushing for transformative change and social justice. Part of the work we do is publishing research and organizing events and activism around big political moments. And in that sense, we've decided to organize a series of webinars which look at the different dimensions of the current political moment associated with the COVID-19 crisis. For more information on our webinars, you can look at the links which you'll see on our screen for the TNI newsletter to subscribe. And also on the TNI webpage, you can see the previous webinars we've done and also connect to this one. This webinar today is available in English, which is a language that we're speaking, but we will also be having a live interpretation into French and Spanish. So a massive thank you, first of all, to our interpreters for helping us out and making this webinar available in other languages as well. And you'll also see on your screen in the next few minutes a live poll which is asking which language you're listening into, so we have an idea of the listeners and the languages that they're listening to us on. So I think that should be on your screen at the moment. So that's just on your screen now. And also then just to mention that the webinar is part of a series which is being co-sponsored by a number of our partner organizations. So just to mention, the webinar is being co-sponsored by Focus on the Global South, by Alternative Information and Development Centre, AIDC, and also being co-sponsored today by the Institute for Policy Studies and by Statewatch. So many thanks to our co-sponsors for making the details of our webinar available as widely as possible. So before we start, I'd like to just mention our panelists. So as I said, states of control and the dark side of pandemic politics is the discussion topic for today. And we're very happy to be joined by 4 experts who can hopefully help us to delve into this theme and understand it a bit deeper. So we have UN Special Rapporteur Professor Fionnuala, Dr. Arun Kundnani, Professor ANURADHA CHENOY, and lawyer Maria Paz CANALES. And I'll introduce each of our speakers as they come to their interventions. But maybe just first to mention the format for today's webinar. So the format is that we'll be discussing with our first intervention will be from Fionnuala, and then will be followed by interventions from each of our other speakers. And while the speakers are speaking, there's also a chat function that you can see in the webinar where you can also engage with the discussion through the chat function. And there's also a questions and answers button where you can also pose questions to the speakers. And if we have time at the end, I'll try and transfer some of those questions to the speakers and we can receive their answers as well for that. And also, if you're on social media, there's a hashtag which is TNI webinars. So if you want to also exchange some of your discussions and chats and thoughts and reflections in social media, there's also a hashtag where you can do that. I think I've mentioned everything that I need to mention before we kick off, I hope. So to get us started, I'm going to first of all introduce our first speaker. So Professor Fionnuala Ní Aolain, we're delighted that she can join us. She's the UN Special Rapporteur on the protection and promotion of human rights while countering terrorism. She's also concurrently the Regents Professor and Robina Chair in Law, Public Policy and Society at the University of Minnesota Law School. And she's also Professor of Law at Queen's University in Belfast. And so Fionnuala, we have asked to discuss, I suppose, as an opening discussion on the concept of what an emergency is, what constitutes an emergency, what are emergency powers, what's permissible under emergency powers when you derogate from international human rights law, how can you do so, what's proportionate, what's necessary, and what is done in, I suppose, a non-discriminatory manner. So Fionnuala is going to kick off the discussion, and then we'll hear from our other speakers. So I'll hand it over to you, Fionnuala. Thank you very much.
Good morning, everyone. I'm really delighted to open up this discussion today. I think one of the really important things to note is that it is really valid and significant that we're having this discussion. When we think about other major emergencies, and I think here of the events of 9/11, when a whole range of legal, political, administrative and other measures were taken, the human rights and critical community took some time to mobilize itself. And so I think one of the very positive things that we're seeing in the context of this pandemic is actually very fast mobilization, exchange of information, and a deep awareness across the world about the scale and the scope and the challenge of the powers that are being exercised by states. So let me say a little bit about emergencies. An emergency, by its dictionary definition, connotes the idea of an unexpected event or events or challenge which poses a high burden or challenge to the state. And in that context, the fact of something sudden, unexpected, challenging allows the state to take certain measures to protect the public. Often under international law, at least the international human rights framework, we think of three specific contexts in which emergency powers can be used. The first is safety, but sometimes the term public safety is used. The second is health, and the third is national security. Each one of these is an area unto itself, but they at least allow a framework within which powers can be exercised. And when we talk about powers, what we mean, in fact, is the power of the state to limit rights. And usually, the idea here is that rights can only be limited for tailored, specific, and highly purposeful purposes. That is to say, the right to limit rights in the context of crisis is not a blank check to the state. It comes with certain limitations. So let's talk about those limitations. International law has provisions called derogation provisions in human rights treaties. So that term simply means that a state must formally inform other states and its own public generally that it is taking exceptional measures to respond to a crisis. But again, even under international law, that isn't a blank check for states. There are a number of constraints on the state. So let me briefly say what they are. The first is that the powers used must be necessary. And in the context of a health pandemic, what we mean by that is that they must be necessary to advance health, meaning that a wish list of powers that a state might like to have for other reasons, but are not in any way related to the protection of health, would be prima facie inconsistent with the lawful exercise of emergency powers under international law. The other limitations are that any use of emergency powers has to be proportionate. And by that, I don't mean macro proportionate or wholesale proportionate. I mean retail proportionate, meaning every single measure has to be exercised in order to assess if it is appropriately used. So here again, it's not a carte blanche or open checkbook to the state to decide what powers it wants. And the other major constraints on states is non-discrimination, that any measures taken in response to a crisis have to be equality driven and cannot disproportionately affect or negatively affect one group over the other. So let me say a little bit about what we know about the practice of emergency powers in international law over many decades. So emergency powers are not new. They go back hundreds of years in many cases, in many legal systems, both civil and common law systems. Emergency powers have been used by states to aggregate their power over a long time. And those of us who've worked in jurisdictions like the one I'm from in Northern Ireland, where emergency powers were part and parcel of the system for many, many decades, we know that there are a couple of things that are really problematic about emergency powers. First of all, even temporary powers have the persistent tendency to stick, meaning they just don't go away. So states use emergency powers, resort to emergency powers, but rarely give them back at the point where the emergency is over. So that's the first problem. The second then is that with permanent emergencies, there is a really high correlation between states of emergency and the abuse of human rights. And that correlation has been tracked for many years by scholars, by activists, by NGOs, by UN entities. We see restrictions on the most fundamental of rights, the right to life, the right to be free from torture, but also states of emergency have a high overlap with restrictions on movement, restrictions on speech, restrictions on family life, restrictions on freedom of religion. The third thing I want to stress about emergency powers is that they change the culture, the political cultures of states. They change the ways in which states understand the exercise of their own powers, because generally emergency powers leave states a great deal of latitude to do what they want. And they take out many of the oversight mechanisms that are part and parcel of the, quote, ordinary law. So we tend to see a greater accumulation of executive powers with emergencies. We tend to see restrictions on parliamentary power. And we also tend to see an increase in the capacity and power of the security sector, including the police. All of this to say that emergencies don't, even though they restrict rights, they have these other, if you want, system-wide problems associated with them, which is why we ought to pay really close attention when states use emergency powers. Let me finally just make a couple of comments about what we're seeing right now and what the challenges that we're seeing with the practice of emergency powers right now. So my mandate has been following the use of emergency powers closely around the globe. And one of the things I would say is that we are seeing parallel to the medical pandemic, we are seeing an epidemic of emergencies. So that there's just the scale and the vast use of emergency powers is extraordinary. Some of those are being officially proclaimed, meaning states are formally derogating. They're letting other states know that they're restricting rights. But actually the number of states doing that is very small. And that corresponds to a major pattern that we've been seeing post 9/11, which is the pattern of non-notification, where states use emergency powers, but simply essentially don't tell anyone about it. The second pattern we're seeing is that emergency powers often don't have the title emergency. So if you as a lawyer go looking for it, you're not going to find it quite hard to find. And so right now where we're seeing emergency powers is we are seeing them tucked away into things like health bills, things called sanitation bills. And so for the average lawyer who looks for emergency powers, we don't generally look for them in these places. So that is to say, much of the emergency power being accumulated in the world is hidden. Two other things that I would like to say before I close about the pattern of power that we're seeing right now. One is that many emergencies are de facto. That is to say, states aren't even proclaiming them domestically, and they're not even hidden. They're simply using a range of other powers to do the work. And again, for oversight, for NGOs, for civil society, for international entities like my office, it's really hard to know what the state is doing. And to know what the state is doing is the first step in holding the state accountable. The other pattern that we're seeing is what I want to call complex emergencies. So in many countries, there's already an arsenal of emergency powers. Many of those are post 9/11 terrorism, counterterrorism, and security powers. And so we are seeing extraordinary adaptation by states of those powers into the health sphere. And we see the security sector and private technology firms offering their services to the state, being super helpful in this moment of crisis and telling us all how we can use all of that arsenal of power and information that has been put together in the aftermath of 9/11 and other challenges since then, 5/5 in London and in Spain, many places around the world, how all of that arsenal of counterterrorism and security power can helpfully be applied to the health sphere. And that's a huge challenge for us. And I close by saying that the reason why that's such a huge challenge is that right now, as we all listen to this webinar online, we're all at home mostly, those of us who have homes. And we're all afraid, many people are profoundly afraid. And so one of the challenges for those of us speaking for liberty and for human rights right now is that it's not a popular sentiment. When people are afraid, they will pretty much do many things or most things to save themselves and their family from the fear of the loss of their lives. And so in that moment, we give away a lot. And so that's one of the gravest dangers that face us, is not just the power of government in this moment, but also the power of fear and what that does to what we are prepared to give away in the middle of a pandemic.
Great, thank you very much, Fionnuala, for starting us off. I think there's some very interesting reflections that I think a number of our speakers will come back to and pick up on as we go through the comments. And I think first I'm going to ask our next speaker, Arun, to pick up on some of those, but first just to introduce Arun. So Arun Kundnani is the author of The Muslims Are Coming, Islamophobia, Extremism and the Domestic War on Terror, and also The End of Tolerance, Racism in the 21st Century Britain. A former editor of the journal Race and Class, and is currently teaching at New York University. And Arun is also a TNI associate, and we're delighted that he can join us in this discussion. And I suppose one of the questions, just maybe picking up on what Fionnuala said about the question of equality driven, and that when you derogate from international human rights law, it needs to be necessary, it needs to be proportionate, but also there needs to be a level of equality. And I think one of the things that we had discussed with Arun was this racialized element of implementation, and how there are specific populations. If we think of post 9/11, there were particular populations that were specifically targeted with the measures that came into place. And I suppose just thinking of what's going on at the moment with COVID-19, I think Arun is going to discuss a little bit the particular aspects of this emergency legislation for certain populations. So thank you very much, Arun.
Thank you, Niamh, and it's great that we have over 1,000 people in this conversation right now. So thank you to everyone who's organising this, and to everyone who's part of this today. As Fionnuala was saying, 9/11 is a useful kind of reference to think about at the moment, when we need as kind of solid bearings to kind of get a handle on what's going on. And what we saw then is a very clear example of what was presented as a temporary emergency becoming a permanent state of affairs. The Guantanamo is still open. The terrorism acts that were rolled out around the world in the aftermath of 9/11 have not been repealed. The authorization for the use of military force that was rushed through the US Congress in the days after 9/11, and that basically declared the whole world as a battlefield for the US military, is still with us. And the various forms of racism, that kind of anti-Muslim racisms that were generated out of the war on terror, have been intensifying since then, have been globalizing since then to India, Sri Lanka, Myanmar, and so forth. So now when we look at what's happening, I think the key lesson for us is we need to act now. As Fionnuala was saying, we didn't do a good job after 9/11. We need to act now, because once these things start to take hold, it's harder to undo them later. So what are the agendas that are being rolled out right now? I think looking at it in the most kind of big picture way, there's kind of two what I would call two dreams that ruling elites have. And one is the state dream of essentially emptying public space of unruly populations, whether that's protesters, whether that's the poor, whether that's marginalized groups, whether that's racialized groups, migrants, and so forth. And the other dream is the kind of neoliberal dream of creating a society in which our lives are completely determined by market-based digital algorithms. Okay, and both of those, I think, we can see being rolled out at the moment, and our task is to I think, do everything we can to oppose those agendas. And in the end, what that means is basically defending the very idea of humanity, of being human. So in terms of thinking specifically about the kind of racialized part of this, we're already seeing the disproportionate effects of the pandemic on racialized groups as a result of institutional racisms of various kinds, long-standing, and in the way that that healthcare systems are responding to this. So in the United Kingdom, for example, we have more than a third of the people who've died of this virus are people of color, even though they're about 15% of the population. In Chicago, here in the United States, African Americans are 64% of the people who've died, even though they make up about 15% of the population of that city. In Michigan, 40% of deaths are African Americans, but they're 13% of the population of that state. So massively disproportionate numbers. We're looking at the American Civil Liberties Union are estimating that there'll be an additional 100,000 deaths in the United States from this virus as a result of the mass incarceration of people in jails, simply because of that. Obviously, the impact on the global poor is going to be massively disproportionate and racialized. Frantz Fanon talked about this phrase, "I can't breathe," as a description of the basis for anti-colonial revolt, and that became a slogan for the Black Lives Matter movements. "I can't breathe" is also an apt description of capturing the kind of disparities in access to ventilators that we're going to be seeing, that will determine who lives and who dies. Then there's the new licenses that are being given to police forces around the world to enforce quarantines, lockdowns, shelters in place. And obviously, police forces will implement that in a way that intensifies the existing forms of violence that have long been normalized. So we're seeing that happen around the world right now, in France, in the banlieue, in the suburbs, in cities like Paris. These measures are being forced to 3 times the amount compared to other parts of cities. In Greece, we're seeing police forces strip search migrants, spit at them as they're being rounded up. In Bulgaria, we're seeing Roma settlements being walled off, and drones with thermal sensors being used to try and track temperatures. Obviously, with a virus of this kind, you're going to expect, it's going to be reasonable to expect some kind of restrictions on freedom of movement. But what we're seeing happen is not exactly that. It's not being done from a medical basis. What we're seeing is boats turned away while planes are allowed to land. What we're seeing is massive clampdowns on migrants, while at the same time migrants are being placed in immigration detention centres where there's no possibility of isolation, and where the modelling suggests there's going to be something like 75% infection rates. So, in Qatar, we've seen already migrant workers being told that they are being offered testing and then being put in buses, and instead of being tested, being rounded up and placed in detention and then deported, which is obviously very worrying in terms of, we need trust in the medical process to get people to participate in the testing that we need. We're seeing various EU countries turn away refugees across the Mediterranean in newly violent ways. We're seeing in Malaysia, refugee boats from Myanmar being turned away. In the United States and in Hungary, there was already a state of emergency declared before this virus that was defined as a state of emergency around migration, right? So completely unwarranted states of emergency that render this, this particular, kind of ironically make this situation cast in a different light. We are, then looking at the way that right-wing forces around the world are mobilizing around this virus with new forms of racism and nationalism. So of course, here in the US, Trump, since the middle of March, has been talking about this as the Chinese virus, as the invisible enemy. In fact, on exactly the same day that he started talking about that, we saw the same thing coming from Viktor Orban in Hungary. So there's some kind of coordinating response here to try and link this to China.
Thank you very much, Arun, for deepening the initial discussion points that Fionnuala mentioned. I think there's a number of things that you raised there that that I think our next speaker, Aru, will deepen again. So just to introduce, first of all, Professor CHENOY. So Professor CHENOY is a professor and former dean, retired from the School of International Studies in Jawaharlal Nehru University in Delhi in India. She served as the chair for the Center for Russian and Central Asian Studies, most recently authored a book on militarism and women in South Asia, and has acted as a consultant in various capacities, including UNESCO, the UN, peacekeeping, ICRC, among a number of other positions. So I suppose just picking up, Aru, on some of the points that Arun mentioned, I think, I suppose what Arun is mentioning around kind of this idea that this is the virus is being used as a pretext, I suppose, for populations that were already in the margins and were already being targeted by excessive use of force, by excessive police brutality, that were, you know, populations like migrants that are on the people who are on the move, people of color, that were already being targeted. And now with the COVID-19 crisis, there's almost another layer of targeting of those populations. And I suppose it would be interesting to hear, because when we were preparing this, you mentioned a little bit about the idea of an enemy. So Arun finished by mentioning China as being the reason for the virus, and this kind of targeting of China was the discourse that we were hearing from political leaders. And maybe you can discuss kind of the war narrative and this kind of the notion of creating an enemy. So if it's China, if it's in India, I think you mentioned, for example, that Muslims were being blamed for the virus. So maybe you can discuss a little bit that element of what's been taking place in your context. So thank you, Aru. I think you're still muted, Aru. Maybe you can unmute yourself.
Okay, can you hear?
Perfect. Yeah, perfect. Okay. Thank you very much.
Thank you. I'm delighted to be here on this panel. And I agree with the previous two speakers that COVID-19, this period, can be marked as an authoritarian moment in world history across countries, where primarily the chief executives or the regimes in power have used this virus to expand their control over citizens and centralize power even within democratic systems. Now, this is not new, and my central argument is going to be that these national security states have used, you can see it theoretically, they've used the ideology of militarization or militarism to accumulate this power. And they have been doing this over the years, but this has been a great opportunity to legitimize this, as Fionnuala mentioned earlier. Now, just before this virus began in most countries, but it was already raging in Wuhan, most leaders, most regime leaders, but I'd especially say those in right-wing populist countries, and there's been a wave of that in the recent past, from Brazil to Hungary, Turkey, India, Philippines, etc. It was business and geopolitics as usual. In fact, on February 24th, there was a huge event when the virus was raging in Ahmedabad in India, where President Trump and Prime Minister Modi had a huge gathering of 125,000 people cluttered in a stadium, which they addressed. And today, in that very city, a lot of the cases are being traced to that event. So they didn't take note of the danger which was going to prevail. Now, the second thing is, when the virus actually started spreading, almost all states had a similar reaction. They panicked, they were not prepared, They were they did not take citizens into confidence. And they took emergency steps without declaring emergency. So in India, for example, in a couple of hours, a complete lockdown was decided. And from the Prime Minister's speech at 8 p.m. at 12 p.m., everything, including all public transport, was shut. Now, India, like many other third world countries, is hugely dependent on a working class which is based on traditionally internally migrant labor who come from villages into town. Of course, some are settled there, but these are very often daily wage earners. Many are self-employed. So the panic of the state spread to these workers, and they wanted to go back to their villages because they knew they couldn't sustain themselves without those daily wages or even with regular wages. They live in cramped conditions and with very little basic amenities to health, sanitation, water, and those kind of access. So they actually started this long march back to their villages on foot. And I think the entire world saw that, where about 700,000 people left different cities to walk home. And this was completely undocumented of how many got lost, how many obviously died of fatigue and hunger. We saw the image of a 12-year-old girl who left and died just a few kilometers from home. And it was really heartbreaking because she was obviously, all laws had been violated. She was child labor, she was a domestic help, she was an informal worker, and there she was who died on the way home. In South Africa, for example, despite the moratorium on evictions, many municipalities use this to evict the informal workers from informal colonies. So what you had now was a new kind of invisibilization, a kind of a protectionism imposed on communities and invisibilized borders, where the outside parameters within states, of course, state borders were also closed, because what all states did was, close interstate transport. But even within state, there were now these new invisibilized borders between village and town, between gated colonies and outsiders, and these kind of borders and protectionist measures. Then there was next the enforcement of these of this lockdown, which was for some a lockout. For others, it was a lock-in. For women, for example, who were locked in within an abusive relationship because you had a huge rise in domestic violence. And so this lockdown affected each community unequally and differently and was clearly gendered in every way. Then there was this use of force. Of course, because citizens were not prepared and they had panicked and they needed to get basic groceries, shops were closing down. The police in many areas, in some countries, including in Israel, in Philippines, in Iraq, in Yemen, the military was put onto the street. So it was completely militarized, the lockdowns there. And besides using force and you saw lynchings and you saw beatings up on the roads of many of the third world countries, where people were, there was even in Philippines, for example, shoot at sight orders. If anyone violates, shoot at sight. So that threat and fear and anxiety was actually exacerbated instead of empathy and understanding of the fear from the side of the state, which they were supposed to do. So besides the regular police and paramilitary, there were also the self-appointed vigilantes, which is a phenomena again of militarized third world countries. Vigilantes linked essentially to many of the right-wing populist regimes and governments in power, who took on the role of stigmatizing particular communities. And then next I come to this whole thing of this blame game, which Arun also spoke about. For India, the 9/11 moment was, of course, different, like it is, every country has its own specificities and regional variations. For India, it was, I told you so. We told you that we've been suffering from terrorism and the world didn't listen, so now you've had it. But they also used it to further stigmatize. And of course, India's had the problem, a genuine problem of terrorism in many of the border areas in Kashmir, etc. It was further used to strengthen laws, very strong laws of things like called the Unlawful Activities Prevention Act, which are completely draconian, in which the police or military can convict somebody without giving you any notice, and you're incarcerated for long periods of time. So now that there was this lockdown and already the use of brutal force and brutal methodologies, you do need an enemy in all these national security states. For the US, for Hungary, and for several others, China was a convenient excuse. India did not stigmatize China, but unfortunately for India, one sect of the Muslim community in Delhi did have a congregation in which a lot of people came from the Gulf areas and other areas, and there was a similar congregation in Malaysia, and many of them did prove positive. But there were similar congregations of different religious sects also, and there were many collective events. And this was at the cusp of declaring a lockdown. But it was a convenient use for the trolls and for those who believe in identity politics and who use majoritarian politics to further stigmatize the Muslim community. This happened in India, in Myanmar. It happened in many Southeast Asian countries where these Tablighi Jamaats went back from Malaysia into Southeast Asia. So there was a surge of Islamophobia. In fact, there was a surge of Islamophobia where it's always been, including in Israel, where there was this dog whistle politics, and the police and military clamped down on a lot of Palestinian villages and communities also. Then, besides that, alongside was the militarized discourses, where instead of showing this as a pandemic, it was seen as a scene of war. In fact, I just want to quote to you what President of Uganda, President Museveni, said to people in a public speech, where he said, in this pandemic, it's like a war. You should not insist on your freedom. You should willingly give up your liberty in this war. You shouldn't ask for bread and butter like spoiled children. You should listen to what the authorities are saying. So while in Uganda, this was said very openly, in other places, it was said through symbols and other kind of methodologies. This discourse in many places transformed into practice. In fact, if you heard words like herd community or COVID co-mortality, those were not words which should have been put out into the community, because that was like collateral damage in war, or like human sacrifice at an earlier period of war. And when it got translated into practice because of this paranoia, there were scenes that you might have seen of police using chemical disinfectant on migrant labor, of plans of having chemical tunnels into residential colonies where people who were coming in, delivery boys, for example, would have to, or domestic staff would have to pass through these chemicalized tunnels. But it was it was kind of made very humorous when President Trump said that, he also advocated the use of disinfectants. But there was this discourse, and many people, many leaders in the regime talked about themselves being war presidents, etc. So this was used as part of the national security discourse, and dissent was really at the receiving end. Journalists who were reporting, and also non-violent dissenters from earlier periods. In India, there had been a long kind of struggle against new citizenship laws, which were seen as discriminatory. And people who led that struggle, and some of the young Muslim boys from a particular university in Delhi, they have recently been picked up. Students from my university, photojournalists from Kashmir, others have just been picked up under these very draconian laws, and they have been incarcerated. So in jails at a moment when actually they should be looking into the fact that jails should not get this infection. And these were all non-violent people who were willing to engage in any kind of conversations, but they've been locked up. I won't talk more about emergency because I think Fionnuala and Arun have done it, but there was a kind of an emergency response. And my last point really is the fact of the continuation of the COVID geopolitics, because if you see last week's CIPRI report, it showed that there has been no end to defense spending. So if you're talking about emergency and war measures, where is the defense? There is no defense against this. The citizens should ask, where is the defense against this virus? What we needed actually was the traditional guns versus butter debate and transfer of defense expenditure for health expenditure, which all the social communities, the bodies, NGOs, United Nations has been talking about. And lastly, sadly, the point about regional and international organizations who also failed in their duty. ASEAN or SAARC, that is the Association for the Southeast Asian Nations, or even the EU, they were more concerned with closing border than actually solidarity. Especially ASEAN has been blamed for that. There was a small SAARC fund, but Italy and Spain, I saw, complained about EU not giving enough assistance, even at a time when doctors from Cuba flew into Italy. And on the other hand, the United States moved out of the WHO, and there might have been some kind of objective politics, but this was not a time to do so. So there were a lot of failures, and it was like international unlegal activities being domesticized. Thank you.
Thank you very much, Anu, for in such short time taking us through all of those different dimensions of what this has meant for India and for other parts of the world that are experiencing the COVID-19 in various ways. I want to bring in now Maria Paz Canales, who is going to take us to a different dimension of the discussion. So Maria Paz, to introduce, first of all, is a Chilean lawyer and the executive director of Derechos Digitales, digital rights campaign, and she's looking specifically at human rights in the digital environment. And I suppose one of the things that we haven't discussed so far in detail in this discussion is around the role of technology and how technology is being used as part of the rollout of authoritarian measures. What role is technology playing? What part of this is new? What has already existed before? And I suppose linking it very much back to what Fionnuala started at the beginning when we discussed the states of exception. What of this has come from other emergencies in the past, and how will that continue to be implemented going forward? So I'll hand the floor over to Maria Paz. Thank you.
Thank you very much for the invitation and for all the audience that we have with us today. Yeah, I will link fundamentally the conversation of the use of technology with many of the points that have been raised already by my colleagues. So the first thing that I think that it's a good starting point for talking about the role of technology in these circumstances and how it can be used by the different variances of authoritarianism that we are seeing for fighting this pandemic is precisely things that were mentioned before regarding the narrative of war and the narrative of fear. So in the past, in other emergency situations that have been highlighted as the counterterrorism strategies and other public safety crises that appear in different countries, the work against criminal organization or other kind of social problems that have been fighted through the use of some of these authoritarian measures. The technology has become an essential piece of this. So as the world has evolved in the strategies of militarization, the technology has been considered a fundamental part of these different strategies. So right now we are in a situation in which, as Fionnuala was pointing out, many of those technologies that were already deployed in those moments for fighting these previous crisis with a very questionable discourse in terms of the need of give up rights for allowing the deploying of these technologies have been repurposed by the states and by the companies that offer many of these technologies with the purpose of being helpful in the fighting of the spread of the disease. And here we connect this point with the fear that I was mentioning at the beginning, and it was raised by Fionnuala at the beginning. So what makes fear? Fears make people to try to find not only a responsible of the crisis, which was also raised by the previous panelists in terms that try to blame a specific group or control specific groups, but also make people be really keen of trying to find a shortcut, a very good solution that tackle the situation and the problem in a more efficient way. So nowadays, what commonly is regarded for looking that easy solution is technology. And as I mentioned, we have seen this before in the deploying of technology for different strategies in the past. And this is very much being labeled as the techno-solutionism that many states, but particularly authoritarian states, are very tempted to use in all this dynamic of war. And what we can see on that is this discourse of, as Anu was quoting the Ugandan president about this logic of giving up rights because it's not the time to care about these other things. These are kind of luxuries, and in a wartime we should be willing to give up anything for just being protected. And this is a logic that, of course, it's very straight line for authoritarian governments, but it's not a logic that usually we should see in more democratic regimes or in general for a state that fulfill the rule of law. What we can see in this kind of a state is that any kind of measure that need to implement extraordinary deployment of technology that can have any impact on human rights should be regarded, evaluated if it should be deployed or not according to the international human rights standard. And there, the principle of legality, necessity, and proportionality are essential, because what we are talking in the case of use of those technologies that can impact the exercise of rights, it's the moderate some of the aspect of the exercise of right, but never we can talk about erase them totally. In the past, many of these programs that we have been mentioning that have been deployed have also the issue that they tend to stick and then tend to stay. And what we are seeing now of the repurposing of many of those technologies for the surveillance in the context of pandemic is precisely what we are talking about. Many of those technologies were deployed many years ago. They never have show that they are really effective for the purposes that they originally have been deployed. They have impact massively the rights of people, particularly of the vulnerable groups that have been mentioned before in this conversation. And now all that technology is being whitewashing in some way by this new use that want to be done for fighting the pandemic. So the final excuse for make those invasive and harmful technologies for right to stay for even longer period that we have had already. So finally, I think that for closing this initial intervention of myself, I want to be a little bit more precise of what type of technology we're referring when we are talking about this. We're talking about surveillance communication technology that have been deployed in the past, for example, to follow the activities of people through geolocalization. Nowadays, a lot have been said about how geolocalization could be useful for tracking the spread of the disease. And people usually got caught in this kind of narrative without looking into the details of the real capacities of the technology that have been deployed and the fundamental capacity of this technology. In this case, for example, we have to keep in mind that what we are trying to do if we implement these technologies is to try to make a more efficient fight of the spread of the virus. But we don't want to fight people or make shame of people that is infected with the virus. So in the case of use of data localization, this is not a type of data that in general has the granularity and the precision that many times is being advised by the state that are trying to implement this solution. So at the end, the use of the data is not granular enough for measuring the possibility of transmission of a virus that spreads in 1 or 2 meters for situation of contact of 1 or 2 meters. These technologies have a variability of between 5 and 500 meters. And what it means this is that we are collecting that information about the location of people. What we are doing is not surveilling the virus, we are surveilling people and exposing that people to risk of being discriminated, marginalized, all the things that we have heard before. The same with the use of other kind of technologies, for example, facial recognition, that is something that have been deployed in the past for public safety, for national security purposes in the context of terrorism, is the same. The ability of that technology to really be helpful in these circumstances is very limited. The same lack of precision that this had in the past for the original purpose that was deployed, this is still the case for using this technology in this context of pandemic. So many of these things are not really technically efficient or proportionate in the use, and we should look at them in a more critical way when we are approaching and not let the people get caught by the fear and the appealing of this techno-solutionism that is being brought by many authoritarian governments, but others that used not to be so authoritarian, but the fear is making them feel that this is the only way and not exploring alternatives of technologies and purposing of technology that could be compatible with the exercise of the rights of the citizen.
Perfect. Thank you very much, Maria Paz, for that intervention, shedding light on a side of this that we're only beginning to get to know. I think the digital surveillance and the impact that's having now and that may have in the future also. So I think thinking in terms of the future, maybe I'll go back to Fionnuala, because one of the questions, I suppose, or the talking points that you had mentioned when we were in touch before was what will happen the day after the pandemic. So when the immediate medical emergency subsides and we're left with a world that looks somewhat different to the world that we knew before we went into lockdown, what kind of world will we be emerging into, I suppose? So I suppose, yeah, just maybe some thoughts on what that might look like the day after the pandemic, I suppose.
Yeah, so I think, of course, no one knows, first of all, the day. I'm also not sure we'll have a day. It's clear that this may be not an event, but a process. And I think that's an important way to think about it. So I think on one very, in some sense, Orwellian sense of what might happen out of this period, we could imagine a day after in which we have empowered authoritarians. We have weaker democracies. We have a weakened multilateral systems. It's already deeply and profoundly weakened. We have a narrower and tightly squeezed civil society space as civil society struggles to survive the pandemic, literally survive, as organizations struggle to stay in place. We have really an empowerment of the language of militarism and power and in a sense the opening up of the state in a way, the empowerment of states in ways that are profoundly discordant. But I also think there's potentially opportunity, and the opportunity is in part seized in the moment that we're in right now, which is crisis is innovation. Crisis throws things upside down and inside out. And often even in the middle of that disruption and the pain that it brings, it actually brings extraordinary opportunity to rewrite some things. So in a way, I think when we start to think about the pandemic and the use particularly of exceptional powers, the pandemic illustrates structural failure. It speaks to the lack of enforcement for fundamental rights like health, water, housing. If we think of the conditions conducive to the crisis, the conditions conducive to the crisis are the things that we need to focus on in order to emerge better. I think if there ever was a debate that health wasn't a human right, we've shut down the world on the basis of the protection of the right to health. So maybe that argument is now moot. Now the question is, what do we do having, quote, won the argument that health is a right? So I do think there's opportunity. There's opportunity in new ways of organizing and really being intentional as a community. There's an opportunity in forcing, even from our homes, our leaders to speak to rights and to be innovative in that. And I think there's a way in which calling to account, and it is in fact the global effect of the pandemic that allows us to mobilize in a way that we haven't been able to mobilize before. Post 9/11, if you were talking about human rights, the assumption was you were talking about, quote, the rights of terrorists, and therefore there was no legitimacy or basis in making an argument from rights. But every single person's rights are being impinged upon in some way, and some more than others, and that is patently clear. But in that moment, it allows us, I think, in fact, to reclaim the language of rights for all. And that's both rhetorical, but also has to be profoundly practical.
Thank you, Fionnuala, for those thoughts. I think maybe I'll turn to Arun next and maybe pick up on some of those. So Fionnuala mentioned that this is a moment of opportunity. And while we heard kind of the darker side of what's going on with the empowering of states towards authoritarianism, we also have an opportunity for movements and for mobilizing ourselves and to do that on a global scale, I suppose. And I suppose that's part of us holding these webinars to build around the ideas. So in discussions before with Arun, he mentioned a little bit about building a new social order. So I'm going to pass the floor over to Arun to develop a little bit further the idea around that.
Thank you. So I guess the first thing I'd want to say is I'm not sure, I think Fionnuala is right that we've, if anything, we should be in a situation where we can say we've won the argument that healthcare is a right, but I don't think we've won the battle for the kind of global public healthcare system that we need, right? And so, I think that's why, a couple of days ago, my daughter saw her doctor via a virtual online kind of video communication thing, right? And so I think what we're going to see is corporations try and exploit this situation to create their version of a new agenda, right? A new world order, right? And that's one of the things that we're going to be up against is, once we've got used to having so much more of our social lives done in this way that we're doing it now, digitally, through dependencies on corporations to provide those relationships, to mediate those relationships, right? They're going to want to keep us in that place as maybe we move out of an emergency situation, right? So they're going to say, well, seeing as we were able to deliver healthcare via video links, why don't we just make that the standard for poor people, right? They're going to try and say, seeing as we've been delivering higher education online, why don't we just make that the standard for people who can't afford in-person interactions, right? So, billionaires are doing well out of this, right? Institute of Policy Studies had a report out a few days ago that said the wealth of billionaires in the United States has increased by 10% in the last month. Okay, because there's opportunities here. It's Naomi Klein's idea of the shock doctrine, right, which is what we're seeing. Boris Johnson gave a speech in February in which he said, he said there's a risk that new diseases such as coronavirus will trigger a panic and a desire for market segregation, by which he means not running everything by markets. Humanity needs some government somewhere that is willing at least to make the case powerfully for freedom of exchange, the right of populations of the earth to buy and sell freely among each other, right? So, the idea that this is an opportunity to push for a free market agenda. What we need to be thinking about is how do we oppose that? How do we start to think about social life in ways that is possible in this situation of a pandemic? I don't know that we'll, as Fionnuala says, I don't know if we'll reach a day where suddenly, we can go back to the old world. So, we need to be thinking about what that looks like and how we avoid this situation of having our lives just kind of frozen in this moment, which would suit the corporations very well, because we're all at home, if we have homes, and we're all scared and we're all isolated and we're all privatized, and people who are trying to protest, like the people that Professor CHENOY mentioned in India, the migrant workers there, the people protesting in South Africa because they simply have no food. Those people can be met with harsh authoritarian measures that seem legitimate in a situation of quarantine, right? So what we have to remember is we can protest now, right? We can organize now. That's what our strength comes from, right? Our strength comes from the streets, and we can't give up the streets. Actually, we can't give up public space. And there's all kinds of things we can be doing, safe things that we can be doing, even in this situation of quarantine. For one thing, if you're considered an essential worker, right, it's probably safer for you to protest than for you to actually turn up to your job, right? So people working in Amazon warehouses, it's probably safer for them to pick it outside the warehouse than for them to be in there. There's people that are coming up with all kinds of new ideas of how to organize in this moment. There's absolutely no reason why we can't have a lively, active movement building process going on at the moment. And for me, that's we're going to need to defend our sense of human connection here, right? Sivanandan, the political activist and writer, I think puts this very well when he says we need to hold on to a simple faith in human beings and a deep knowledge that by himself or herself, the individual is nothing, that we need to confirm and be confirmed by each other, but only in the collective good ourselves can put forth and grow, right? So I think we need to defend that human sense of the collective, of the connection, of building movements. As my friend, the journalist Susie Day puts it, the revolution will not be quarantined.
Great, Arun, thank you very much for that. I think that phrase, the revolution will not be quarantined, is one that we can definitely all take from this webinar and use it to organize afterwards. And I think many of the questions that have come through on the chat actually have been around organizing and how to respond, in solidarity, but in a safe way that doesn't put people at risk. So I think that's definitely a theme that's been coming through in the chat, that a lot of people are interested in mobilizing around this. I think, Anu, I'll turn over to you now, because you had mentioned a little bit about democracy and participative democracy, and if you have a state that is shutting down its democratic structures, how can we push back against that? And you had mentioned some alternatives when we spoke earlier. So maybe you can, in a few minutes, maybe you can just try and summarize some of those for us.
Yes, I think it's very clear that there are two alternate paradigms which have been available and have shown themselves even in this crisis. Because there have been states, especially with women leaders, whether it's Angela Merkel or in South Korea or New Zealand's Jacinda, which have worked very well through democratic procedures, as opposed to those who've taken on these kind of emergency powers. So you already have in state power two alternative paradigms which are functioning. Similarly, within states, and I'd argue, for example, in India itself, you have some states like the state of Kerala, which has handled this very well. And it's even been covered for example, in Washington Post, how this left-wing government has treated, they call their migrant workers as guests, not as migrant labor. They provided them with facilities, including even with entertainment, so they don't go back. They pleaded with them not to go back. So there are alternatives within state power. Secondly, within civil society, I've seen in India a lot of civil society. You see, the compact between civil society and the state has been breaking down over the last few years because civil society was arguing for an alternate path of development and not a GDP obsessed path of development. So the state had decided to curb the strength of civil society, which is quite strong in a state even like India or Philippines or many of the Southeast Asian countries. Even in Africa, there is a developing civil society, especially in Europe. And in this crisis, civil society has shown its strength at a time when the state failed to deliver. They're the ones who have been delivering food packets from communities to the migrants, etc. So we hope that the state continues to remember what civil society does and how important it is for a functioning state and especially a functioning democracy. The other thing is there have been symbols of solidarity, whereas on one hand, you have a very toxic press like Fox News in the US or many of the channels in India. You have emerging alternate press like The Wire, which I have quoted, Citizen, and many online newspapers who without any inhibition are speaking the truth to power, are doing critical thinking, and are engaging scholars. So that continues. There are universities which have resisted the clampdown. My university, for example, is one of them. And there are a lot of people from there listening in today. These ideas, we need to connect them. It's not reinventing the wheel. They are there. And we have to show that there are these two paradigms, and the paradigm that civil society, critical scholars, thinking individuals, organic individuals need to put it out there. And we need to turn these tools of surveillance into tools of cracking the dominant hegemony and putting our ways. And I think this has come across in many ways. So instead of globalization, there should be this kind of international solidarity, which I'm even seeing today. Thank you.
Thank you very much, Anu. I think maybe I'll go to Maria Paz now and ask if you can maybe pick up a little bit on a lot of the questions, like I said in the chat, have been around mobilizing and how can we do that at the moment. And I suppose one of the obvious answers is online, because that's how we seem to be meeting each other digitally at the moment. So maybe you could discuss a little bit, how we can use technology. So we discussed before how it was being used in an oppressive sense to track and monitor movement and that kind of thing. But I suppose it's what we're also relying on to organize, like I said, in the use of these webinars and other such instruments. So maybe you can discuss a little bit thoughts that you may have about mobilizing and the use of technology in that sense.
Sure. I think that this is a critical point, definitely, in this moment, because it's one of the points in which you can illustrate the two sides that have been described, the opportunity and the risk. Because the opportunity is finally questioning the way in which technology have been developed at this point. So all the surveillance capitalism technology have been questioned for a very elite circle, for saying in some way, because there are just few people around the world that is really aware of the dimension that surveillance capitalism had in the past. Increasingly, with past situation as the scandal of Cambridge Analytica and everything, that was more mainstreamed. But right now that everyone is forced to be online, and many of our interaction that we could have in the past in a physical way, as the protests and everything, it had to be organized online. It's a good opportunity for mainstreaming the consideration about how we should think for the future the development of technology with a different logic, not this capitalism surveillance logic, but to try to find alternative ways to develop that technology that really serve this principle of solidarity and social movement that we are talking now. And it's really, in some way, disappointing that sometimes when people ask us, the activists that we're working in digital rights, what tools to use today for better organize, and there are not a huge variety of tools that we can advise for saying this is more secure, this is something that is more aligned with the principle of social movement. So finally, this is a point in which we can think and we can collectively organize for creating this new technology that will serve better the purposes that we are much aware that we will need it. And then we have the other side, that this is the critical point that we have to have when we confront the use of technology for different aspects by the governments, by the private sector, in different areas, in the healthcare provision services, but also in the welfare state. Many types of technology that live with us today and we will accompany us even more in the future. We are in the precise point in which we should ask, because we have learned during this crisis that the way in which that technology is designed and deployed matters, and it should be deployed and designed in a way that is human rights perspective from the very design, and not wait for this kind of crisis to confront us to this false dilemma of picking between the different rights that are in place. So this is another point in which the awareness that we have in this moment should fool the social movement to talk and to be more exigent with the interaction with the governments and with the companies for the future.
Thank you very much, Maria Paz. Another question that came through on the comments in the chat was around the question of health. So Fionnuala, you mentioned earlier that if there was ever a time when we were sure that the right to health is indeed a human right, that we're at that moment now if we hadn't been there before. And I suppose that the question that came through is, what if health now goes beyond being seen as a human right and starts to be interpreted as a national security issue? And what might that look like if we start to weaponize our understanding of health? So maybe you have some thoughts on that.
Yes, so I think we are facing a prescient danger. On the one hand, there is, as I've said, this idea, the fact that the right to health, even though it's also notable that many leaders don't speak in terms of rights when they talk about health. But also I think the language of indivisibility of rights is seeing a new moment, right? Where we understand the linkages between civil and political rights, economic, social and cultural rights. It does seem to me that there's a moment to really re-own that space of indivisibility. Historically, it's interesting to note that in previous health emergencies, so H1N1 is probably the best example, these were actually the best performing emergencies historically, in the sense that it's one of the few areas of practice internationally where the use of powers taken by the state have been returned. And so one thing I think we should hold on to is not at the scale of this pandemic, but we've had prior examples where states have had to take emergency powers to address health challenges. And it's the one unique area where by and large states have given their powers back. So that's one important lesson that we bring into this. The second is really, I think, to robustly defend about the securitization of everything, because we've already seen this in the counterterrorism space. We see it in preventing and countering violent extremism, which Arun has written about extensively and is an issue my mandate is deeply concerned about, where the use of the term extremism then infiltrates security into homes, it infiltrates into doctors' offices, into teachers' classrooms, because everybody becomes a watcher for extremism. And so we're already there in the securitization of health spaces through exceptionality. And I think this is the moment where we have to say that's not an acceptable extension and actually push back really forcefully against that. We've been struggling to do it in the counterterrorism space. And actually, I see this as an opportunity to push back against that. But yes, it's deeply worrying when we see, for example, you know, a discussion in the United States about reframing the National Security Council to take care of health as an issue. All of us concerned with rights should be deeply worried. And that is true globally, where states will utilize and exploit this moment in highly nefarious ways.
Thanks very much, Fionnuala. I might also, because you mentioned Arun, and of course Arun has written a lot about extremism and combating violent extremism, and yeah, I suppose the post 9/11 and what that meant for certain communities in, for example, in the UK, where we've seen Prevent being rolled out and other programs across Europe. I suppose just picking up on some of the points that Fionnuala mentioned, Arun, maybe you have some comments also that you can add in that sense.
Yeah, you know, so last year, in fact, I did a project with Transnational Institute and some colleagues where we talked about what would it mean to rethink what security is, right? And in the context of the UK, in that project, and you know, given that we're spending billions of pounds and you know, in other places billions of dollars, billions of euros on security, what would be a progressive alternative to how we use that resource? And you know, one of the things we said was actually the way that we should think about what security is going to be about healthcare as much as anything else, right? It wasn't that we had some golden ball where we predicted what would be happening this year. It's just we were, you know, drawing on what all the peace activists and all the scholarship around rethinking security had come up with. And you know, the problem is that it's that old saying of like, when you're a hammer, everything looks like a nail, right? So when you have a global public healthcare crisis confronted by militarized nation states like the United States, they want to turn it into something that fits with what they're good at. They're certainly not good at public healthcare, especially global public healthcare. What they're good at is nation state violence. And that's why the China narrative becomes so important, because they're trying to frame this as a matter of inter-nation state violence and rivalry. And that's why it's something that we're seeing not just in, you know, it's there on Fox News. You know, Fox News is circulating these conspiracy theories that the virus originated in a lab in China. So is the Washington Post, right? Josh Rogan at the Washington Post is promoting that idea. Congress is pushing at it as well. So, you know, what for me is, you know, so obviously we can imagine all the dangers of how that intensifies securitization, militarization, and so forth. But the other part of this is, you know, what they're getting ready for is the point at which people start to say, why did this happen, right? Because that's going to be the crucial thing coming up now. Is once we've sort of started to get out of the immediate sense of everything being thrown up in the air, why did this happen? How can we stop it happening again, right? And the answer that you know, for me, the best answer to this is the kind of things that people like Mike Davis have been saying, which is, you know, these kinds of viruses are in the end the product of capitalist agriculture, industrial production of meat, environmental destruction that create the conditions for these kind of things to happen. You know, so by being able to think, well, there's some other part of the world that can be blamed for this, whether it's China or whether it's Muslims or whatever, enables us to avoid that really important question, right? And it enables us to avoid, you know, as Mike Davis puts it, the realization that capitalist globalization is unsustainable biologically without a global public health infrastructure, right, which is what we need right now.
Thank you very much, Arun. I'm just looking at the time. We have just under 10 minutes left. And I just wanted to go really quickly to Anu and a question, just that you mentioned the gendered aspect of the response to this crisis in militarism. And you wrote a book, in fact, on militarism and women in South Asia. And I just thought if you could maybe, because we've very little time left, but I think it would be worth maybe just giving us a few points just on particularly on the gendered aspect of this.
I think what the feminists have actually been arguing on intersectionality comes out very clearly if you study both the virus, the responses, and the good responses and the bad responses. The good responses show that health, of course, has to be prioritized, and people all over the world now, I think, are going to get restive and question their leadership. That what happened? Why weren't we, why weren't we provided with adequate health? So this is going to be on the agenda, and I think it's time that this kind of the way women approach this through a care economy, through lives and livelihood along with life, health, there has to be a livelihood. Along with that, there has to be a living wage, that domestic labor needs to be recognized and maybe even monetized, but they have to go into it. I think the way the feminists have approached this, of course, there are differences within them, but it's a way out of the crisis. And it's a long-term solution. And I think we need to look at it through this kind of lens.
Perfect. And we're hoping to do, I think, I'm not sure that it's arranged yet, but the idea is that we will have a webinar in the month of May. I think that we look at the crisis with a specific feminist lens. And then because we're nearly out of time, just with Maria Paz also, we'll be having, just to mention that we will do a webinar also in May that will look at the issue of surveillance and data rights. So maybe Maria, you can give us maybe 2 or 3 thoughts around what data rights might look like in this crisis, just to kind of wrap up, and then I'll close formally.
Sure. Yeah. When we are talking about data in this context of the pandemic, the first thing that we should clarify for the general audience is when we are talking about the power of data, that is true, but not all the data is equal, is the same in terms of the value and in terms of the harm that it has. So a lot of discussion had been around just quickly collecting as much as data as possible from people, from the general population, and then decide how that data could be useful for fighting the pandemic. So the same logic of the startups and the capitalism surveillance that we have talked before. So in this moment of crisis, what we should do as citizens is ask ourselves and demand from our authorities that are looking into these technologies as a possible piece of the strategy for fighting the pandemic, is be much more critical about what type of data is useful for which purposes, and how we can do from the very beginning this exercise of minimize the possible harm for the exercise of rights of the use of data. Because there are a lot of data that can be aggregated without identifying individually the person, that can be very helpful for fighting the pandemic. It will allow to the governments to make a better strategy in how to allocate resources, testing capacities, health services, to go to assist in a better way the most vulnerable population. But for that purpose, we don't need to know about exactly the identity of the individuals that conform to group, because that information can put the same people that we are trying to help in a very big risk of discrimination right now, but also it will be something that will be pervasive for the future, with the possibilities of employment, with the migration status, a lot of very relevant consequences in the exercise of rights. So my invitation as citizens is to understand this issue about data and be critical about what type of data is being collected, what is the type of use, and what is the type of control that have to be established for really have this data helping to the purposes of fighting the health crisis, and not harming additionally people, put it at risk of discrimination and violation of their human rights. I will leave it there for the next session.
Okay, perfect. Thank you very much, Maria Paz. And I think we're nearly out of time, so I'm going to do the round of closing. So I suppose, yeah, just to say before we close, thanks a million to the organizations that co-sponsored. So the Institute for Policy Studies, State Watch, my screen just disappeared, sorry, the Focus on the Global South and the Alternative Information for Development Centre, AIDC. Thanks to our interpreters who've been interpreting us simultaneously during the last hour and a half. And also to my colleagues at TNI, to Jess and Nick in particular, for supporting. And finally to our speakers. I think our speakers gave us an awful lot of, well, food for thought. And I think, yeah, to Fionnuala, Arun, Anu and Maria Paz, it was really deep, engaging conversation, and I'm really happy that we had you on. We're very lucky to have such expertise, I think. And maybe just to finish with Arun's phrase on the revolution will not be quarantined. I think that's the one that we'll be closing today with. And like I said, we have some webinars coming up. So there's one on the 6th of May, which TNI will be taking a break from our regular webinar, but we will be co-sponsoring another one on the 6th of May, and you can see details from that on your screen at the moment. And then we'll be back with the regular TNI webinars on the 13th of May. Yeah, so I think that was a little bit, my screen disappeared, so I hope that you've managed to see those screens on the screens that you're watching. I'm still getting used to using webinars, the technology, so I hope that you were able to see those screens. And so just to close, thank you very much everybody for having joined us, and you can get more information on TNI's website, and you can contact us if you have any further thoughts or discussions. I think our chat will stay open so that you can copy the links from there for the next 15 minutes or so, but for myself and from the speakers also, we'll be finishing. So thanks a million again for everyone for having joined us this afternoon. A special thanks to our speakers as well. Thank you, take care. Slán go fóill.